Good afternoon and welcome to United TV. This is our Bariatric Friday. Today is January 30th, 2026, and we are going to discuss another really important topic for bariatric surgery, and this is the risk and complications and what patients really need to know. This is a must-have topic because there are a lot of information that patient needs to know, and I'm going to have Dr. Isaias Irgau joining me, and he's going to answer some of our questions. Now, we have done this session several times before on our channel. There's a specific playlist for these, and any topic specific, you can go and watch others. So we may not cover everything that is necessarily out there, but we are going to try to cover this with a different approach today. So the goal of the episode is normalize fear without minimizing real risk, explain why complications happen and how often they happen, emphasize the most risks are preventable, manageable, and temporary, and reinforce the importance of the follow-ups and the nutritions and the patient engagements. So we are going to have Dr. Irgau. And Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be back on yet another wonderful session.
Thank you. Thank you for being with us.
Of course.
So, again, I feel like bariatric surgery is kind of like discriminated by the health systems and people and everyone else. And our goal is to fight this perception and then make this real for people and educate public and educate patients who are actually really need this information, and therefore we are going to have some specific questions around the risk and complications. Now, one of the things that we know is a lot of data around the risk and complications outdated, and the other thing is a lot of risk also is kind of like underestimated because of social media. Social media can be the curse, or So now I want to start with the first question. So then it's kind of blunt and straightforward. Is bariatric surgery actually dangerous?
No, the answer is no. There is a very important reason why bariatric surgery is being performed, and that is for the treatment of a far more dangerous condition known as morbid obesity. Like any procedure, of course, bariatric surgery does carry a risk for complication. If we look currently, when bariatric surgery is performed in high-quality centers like ours, the risk for complications is actually comparable to procedures like gallbladder removal or joint replacement surgery, which are commonly done procedures even in elderly and frail patients. That is the level of safety that bariatric surgery has currently achieved. The risk of dying from bariatric surgery is well below 1 in 1,000 in very good centers right now. And one has to look at the risk of obesity. The risks are far greater in terms of comorbidities like chronic disease, high blood pressure, type 2 diabetes, and sleep apnea that carry a morbidity that affects the quality of life, but also early mortality as well. So overall, bariatric surgery, yes, like any other treatment, like any other surgery, does carry a potential for complications, but the option of not doing bariatric surgery and living with morbid obesity has far greater implications for the person than the bariatric surgery itself.
Absolutely. So we know that most complications are happening in the first 30 days, and that's why understanding what may be coming is important. So what are the most common complications right after surgery?
Early after surgery, the most common complications would be bleeding, formation of blood clots, leaks that can lead to very severe infections, as well as problems like dehydration, which sometimes can be very severe as well. Now, these complications, first of all, are very rare, And most importantly, they are actually preventable, right? So if a person is walking very early after surgery, if they have appropriate medications around the time of surgery to prevent blood clots, that's less likely to happen. The techniques we use right now, laparoscopic surgery, is far better in terms of minimizing the risks of bleeding, but also the actual instruments that we use, very close attention to controlling bleeding during surgery, all those lead to really much decreased risks. Leaks, on the other hand, is something that can happen, and that can also be prevented by paying attention to how the surgery is performed, particularly laparoscopically. Again, the rates are also very, very low.
Now, you and I, we get direct notifications when we have any complications, and like after surgery within 30 days. And I just want to kind of emphasize how little these things are. So, when was the last time we had a leak or bleeding?
Actually, we did have a leak this year. Yeah, but before that, it had been really a very long time before I had seen a leak. So leaks are very, very rare. The important thing is to find them early and then address them properly. And there are very safe ways to address them as well.
So that's kind of like answering my next question in a way. So this is not... like if we say percentage-wise, less than 1%?
I would say way less than that. Way less than that.
In
I would
our
say,
program, it's
yeah,
not...
absolutely. I would say it's probably around 0.3%.
So, and then these are also available for public. So, because we report, and every bariatric facility in the nation report the numbers to the national data center.
Yep.
So again, the fear is always there. So then I think the key point is knowing that these are preventable, and what to do for that prevention is, like, sometimes we see the hydration patients in the ER for dehydration. But it was something very simple, but yet maybe the discharge instructions were not followed. So this is, again, still an important surgery, but if you just follow the instructions, things are going to be a lot less risky.
Absolutely.
So,
and then talking about the instructions again, Kemal, for instance, leaks tend to happen in the first couple of weeks, first 3 weeks after the surgery. And patients very often will ask, how do I know if I have a leak? Where if they have severe abdominal pain, if they have persistent nausea, vomiting, if they have fever, if they have rapid heart rate, all those things could indicate that a leak may be occurring. The important thing is, in our instructions, we always tell patients that if they fail to progress day after surgery, they need to let us know so we can assess them. So we can assess them very early, essentially. So means that, if the patient is on their 3rd day, right, and they've been doing well, and then on the 4th day they feel really they're going backwards, we want to know that, because every day we want them to progress. So symptoms that really don't match with this progression of recovery need to be notified, we need to be alerted about them. So the earlier we catch leaks, if they happen, the better the outcome will be with the treatments available.
So the logic is, after the surgery, every day the person should be feeling better.
Absolutely.
So that's just kind of progressing. So anything that's not going well on any of those early days is an issue.
Absolutely. We need to know. And the vast majority of times it's not going to be a leak, but this is the level of alertness we want our patients to have, essentially. This is a very rare complication, but the earlier we find out about it and address it, the better it is, of course.
All right. So the nutritional complications is another issue that we see. What nutrition deficiencies can happen after bariatric surgery?
So iron deficiency is probably one of the most common that we see. Vitamin D deficiency is another one. B12 deficiency. protein malnutrition is rare, but it's also possible, and obviously we have to be on the watch out for that. These are not essentially surgical failures. These are things that can happen, and they are expected to happen if we don't do certain things after surgery. So we have to make sure patients are taking the appropriate micronutrients, including the vitamins that we recommend. We have to make sure that patients are having blood work from time to time. We have to make sure patients are doing their follow-up with the surgeon as well as with the nutritionist in a timely fashion. And provided we do all that, then we are able to prevent this. So these are preventable, and they are not necessarily surgical failures. They are part of the whole changes that occur after bariatric surgery, and that's why it's important to follow the instructions that we give patients about the importance of having enough protein, the importance of vitamins after surgery.
That's kind of like, in the earlier sessions I mentioned this, and well, several times I probably did, but also in our business, I very often repeat discipline and consistency and proactive approach are all kind of the key for the success. This is not just for complications after surgery, but this is for life itself. So if you don't have any health problems and if you don't want to take vitamins, fine. That's a bad call, but so. But if you know you are going to be challenged with this deficiency problem, you have to be very well disciplined and consistent. So if you don't want to take several different things and then just once a week put them in a medication box for each day, if it's a PM and AM, just get one of those. Make it more simple. So life is all about standard routine task that we have. So if you think about it, like every day we have certain routine, like I get up, so then shave and brush my teeth and take a shower every day. Right?
Of course.
Timing may be different from weekdays to the weekend, but we do this. Why we do it? So I can tell you, if I don't do the shower in the first thing, my body is not the same.
Habit.
It's not. So if I don't wash my face in the first thing in the morning, I don't wake up. So, but those are kind of like all kind of important, consistent behaviors that we have to have. Now, the behavior task becoming a behavior is important. So that's what we want people to understand.
Absolutely.
The task is you have to take your vitamins every day. So how can you turn that into a behavior is the discipline.
Yes.
So that's where you kind of really need to understand. We don't want you to end up in the hospital for something that can be preventable and you can safely enjoy your successful results. So same thing with the the dehydration. So that's very simple. So it's so simple. So then deficiency here is is important. So one of my physicians messaged me now. She says she's tired. Well, today probably she's doing something different than she's normally doing if she's not tired other days. But if she's tired like all the time, then knowing her young age, she probably needs to take her vitamins, right? And also outside it's cold.
Yes. Or did she get good sleep?
Like this whole week we didn't walk. So today Joshua is coming to the office to do the walk in the afternoon because it's so limited.
Yes, of course,
so
of course.
That we may be tired because we didn't exercise enough. We didn't walk enough, right?
It's true.
So this key is, I think, turning instructions task into a behavior with the good discipline and commitment is
absolutely
what we want people to understand. So what kind of like uncomfortable symptoms can happen long term?
So in the long term, obviously, many issues can occur because of the changes from bariatric surgery. So, for instance, food tolerance can can occur, and this is related to the type of food the person is eating. Either it's too sugary or too greasy. Acid reflux can happen, particularly if patients have had the sleeve gastrectomy. Something called the dumping syndrome can happen if patients have had the gastric bypass and they eat refined sugars after that.
Ice cream. So we know from the last week,
absolutely,
got 1
absolutely,
out of 10.
yeah, absolutely. Nausea and vomiting can occur, particularly if patients are eating too fast. Sometimes, forgetting that they've had bariatric surgery. These things can happen, but obviously in the long term, depending on the type of procedure one has had, particularly if we take what we call the intestinal bypass procedure, like the gastric bypass, the duodenal switch. Nutritional deficiencies are a real risk, particularly if patients are not up to date with their nutrition of micronutrients, especially vitamins and minerals. But there are other potential problems, like bowel blockage can occur. For instance, if there is a twist on the intestine that has been relocated from its natural place with the surgery, essentially.
This is for the bypass.
For the bypass, and patients need to be aware of that, so that if they have any type of abdominal pain, it's important they report that to their surgeon or to somebody who has knowledge of bariatric surgery. And of course, certain behaviors can impact the risk for complications. For instance, we talk about smoking. If a patient resumes smoking after surgery, and particularly they've had gastric bypass, they can develop ulcers in the connection between the stomach and the intestine that can be very
extremely painful.
Painful and dangerous. They can burst, they can bleed, and be life-threatening. If there is excessive alcohol consumption, many problems we've talked in other sessions can occur as well. So yes, there are potential problems in the long term, but they're all preventable with adequate care and follow-up of the instructions.
So this is true for everyone, right? So some of these things that we are talking about, and I always want to point that out. So, and I use myself as an example, so then it's like at my own cost. So this, food intolerance for like sugar or the grease food. I have that, but I didn't have it maybe 10 years ago. That's because as we are aging and as we kind of try to follow certain diet, I can't really just tolerate certain things. Or if I eat that, like last week we had the Big Mac, Dr. 100%, I'm not lying, zero lie. It's at least 5 hours I feel really disgusted with everything, because that's in the entire system. So it's in your burp, it's in your body. It just, you just don't feel great. And you go home, you have a piece of steak and some salad or some buckwheat, kind of like instead of rice or bulgur, and then I'm full and I don't have any ill feelings, like the physical ill feelings, and I'm good.
Yeah, absolutely.
So, but then, trip is coming to Turkey next Friday, so the challenges, starts. But I think those challenges, if you don't have the surgery, of course, sometimes your body needs to kind of go up and down time to time. But what I'm trying to say is that these things, we have them too.
True.
So if I don't eat in certain times, Dr. Irgau, now we are talking about dumping syndrome, right? So that's different. But in terms of your GI and when to go, it all depends when I eat. If I don't have my time discipline, that's I'm now at the mercy of my body instead of me being in charge of my body.
Right. Because there is disruption of the rhythm, essentially. Yeah.
So keeping this 12 hours, especially at night, which we've been talking about for a long time, it's unbelievable, so important, so that after a certain time we close the shop for the body, and then stop taking any food intake, zero, and then you get up and then give that body like 12 to 14 hours. It works.
Yes.
So, and it's like you feel it. So that's kind of like the main focus that we have. Absolutely. Now, the weight regain we always talk about, and we talk about because usually 90% of the time instructions are not being followed and the commitment is not there, but it happens. So is weight regain considered a complication?
Oh, no, it's not. Many patients believe actually that if they regain weight, they think that the surgery has failed, and that's not true. Some weight regain is actually expected in the long term. The question is when there is significant weight regain, right? And that can happen, and that is very often related to maybe a change in lifestyle, that may be related to a stressful event that a patient might have had. Whether it's emotional eating, whether it is just going for food to find some comfort, all those things, if that change occurs, of course, the body will start gaining weight. When we've changed things with the surgery, we haven't changed the biology. The biology is intrinsically biased towards weight gain, right? That has not changed with the surgery. But we've given the person a tool, a powerful tool, that allows them to maintain a certain weight. Now, if we don't use that tool properly, at some point weight regain can occur in a significant fashion, right? So it's important for patients to get back to us at that time because we can remedy that. We can get back to the basics or do other things that may be helpful for that patient to start losing weight again. So I always tell patients to expect some 5 to 10 pounds, even 15 pounds, if they really lost a lot of weight, of rebound weight gain. So that if, for instance, they feel comfortable at, let's say, 160 pounds or 170 pounds, I tell them, you know what, aim to go a little bit further down, maybe 160 pounds. So you will have a little buffer for that regain. So we're not really concerned for that little weight regain. But if there is significant weight regain, obviously that is a problem and needs to be addressed. The earlier it's addressed, Kemal, the better it is, because it's a lot easier to come down from a little bit of weight regain than from a significant weight regain.
And really, we are talking about this like going all the way down and then just coming back maybe 10% from the floor. That's not even, I wouldn't consider that as a regain.
No, that is normal. That is kind of expected. Yeah, exactly.
In the new norm.
Absolutely.
But if someone lost 120 pounds and then came back like 90 pounds, that's another problem.
That is
and
a significant problem.
We are saying that that's not the surgery, that's what you do after surgery.
Absolutely. So it is important that, if patients are lost to follow up, if they don't reach out when they are struggling, all those are issues. So the most important thing for patients to understand is that, let's say they are now 10 years after bariatric surgery and after having done very well in terms of very adequate, appropriate weight for all these years, let's say a divorce occurs or there is a loss of job or loss of a loved one, and the patient struggles, goes back to bad eating habits, and they start gaining weight. Very often, the instinctive thing for them to do is to hide from us because they feel as if they're letting us down, so they don't want to come.
Right.
That is actually the opposite we want. We want patients to come to us when they are struggling because we are their home. We're the place where they can find help. So, and there's no judgment on us. Before it's too late.
Just like the pain medication, if you are taking some Advil or Tylenol, you don't want to wait until your headache is really bad.
Absolutely.
You want to take it as you start feeling it.
Absolutely.
So that's not going to get better.
Absolutely. So we want patients to come, and we're not there to judge them. We're not there to consider them failures. We're there to help them, right? And we have tools to help them as well. And it's important for them to come. It's not a question of them disappointing us or not. It's a question of them really needing to get back to healthy eating habits, healthy lifestyle, and not have to worry and struggle by themselves with the weight regain.
So one of the other issues is regarding the mental health. And what we know about mental health is patients with morbid obesity may be more vulnerable with the emotional changes and unexpected, like the weight loss is great, but unexpected emotional changes can come with it because the body image struggles for all those times, and then all of a sudden they lost so much, and they don't know what to do with this new themselves. So then also mood changes during the rapid weight loss is fully psychological, and that's why we always ask our patients before the surgery to have a psych clearance. And but even your nutrition visit can turn into a psych session. I'm not saying it would replace, so not medically, but just being able to talk about these problems, and then express your feelings, and then communicate the issues you're having. It's a channel. It's a good channel. So that's why if you feel like you may need more help, you need to. And one really important thing that we are worried about is if the risk of transferring behaviors from, we discuss overeating and eating disorder to alcohol, shopping, and some other obsessions. So those can be better controlled if you also follow our support group, and if you need more attention, if you feel like you need more help, definitely get a counseling. That would be one, but I don't really see that as the complication of it, but it's just the settling and kind of forming the new norm of the new life they claim. So my last question for today, before we have the fun part, is Dr. Irgau, who's at higher risk for complications? So are some patients more likely to have complications? Do we know that ahead of time?
Yeah. I mean, you can even personalize risk really based on the profile of the patient. And there are certain things that can increase the potential for complications. For instance, smoking by itself. If a person does not quit smoking before surgery, the potential for complications can increase. That's why we make it really a precondition before bariatric surgery for patients to stop smoking, right? If there is poorly controlled diabetes, right? If the blood sugar is really poorly controlled, we want that to be under control to a certain degree prior to surgery, because we know that complications can increase in that setting. If patients have sleep apnea, for instance, particularly unrecognized sleep apnea, it's important for that it to be addressed, tested, addressed properly. And although we know that the ultimate treatment for the vast majority of patients is significant weight loss, going through the surgery itself is important that patients are treated for sleep apnea, particularly if they have very severe type of sleep apnea. And of course, if patients are not following up the instructions, if they are not going to be compliant with what we ask them to adhere to, those also increase the risks. So these are all modifiable risk factors. Essentially, if you're a smoker, you stop smoking. If you have poorly controlled diabetes, we make sure you follow up with your primary care doctor or your endocrinologist to follow their treatment plan so that blood sugar is adequately controlled. The same thing with sleep apnea and the other factors as well.
So the main topic and main kind of point for today is every surgery has its own risk.
Yeah.
So like something very simple that takes 7 minutes, like the cataract surgery, if you don't follow the instructions and if you don't keep the eye clean, and then if you smoke, then you are going to get an infection.
Yeah.
And that infection is very painful. So not an easy one.
Right.
Now, like there are times that you need to use your eye drops. There are times that you need to stay away from any area that's not clean, avoid smoking, or avoid any places that's being that smoking is happening. So washing your hands, the hygiene. So appendix surgery, someone can die from appendix. Very simple, straight for a general surgeon, of course. Not I can't do surgery, right? But for general surgeons, so this should be like a very straightforward procedure.
Correct.
But
correct.
someone can die from it if it's not done in a timely manner, or the patients don't follow again the post-op instructions. So the gallbladder and the like even some cosmetic surgeries have like great actually risk, and they are kind of permanent risk. So what we want people to understand is risk is always there, but if it's preventable, that's what we are providing. And in terms of the information. But if if it's preventable and if you can follow these, you get the surgery at the American Surgery Center. You go home in 4 hours, 6 hours average. I'm sorry, for gallbladder, 4 hours. 6 hours after surgery, same day, you are at your home. That to me speaks for itself. So, and of course, this is with the great screening process. The program that we build with the case conference discipline, that every patient is being thoroughly actually checked, and we know we are not missing anything.
Right.
So that also is a huge benefit. As long as it's one of the center of excellence places, you should be in good shape, because the risk of living with morbid obesity is much higher.
Absolutely.
And more complications that you are going to have than having the surgery. So that's a fact. All right, so ready for the game.
All right.
Let's see what we have. Some of them may be repeated. However, the point and the focus we have today is protein addition. So,
Okay.
rate with Dr. Irgau protein addition. So, now I'm giving this disclosures in case we said we rated differently in the other settings, but it's in this setting the rate is going. So, like, you may, have a different answer last time for one of these, but that wasn't in the same protein addition setting.
Yeah.
So I just want
But
people
we'll
to,
try to be consistent.
I see some of my friends saying that, oh, you guys had this and then now it's this. Like, which one? Like, I'm like, okay, so I'm speaking to them. Please don't bother me for that. So, all right, grilled chicken breast.
10 out of 10.
Oh,
This is very high protein, low fat, minimal carbs, excellent amino acid profile. For
10
our
out of
bariatric
10.
patients, this is actually the ideal staple food, really easy to portion, but it's best for our patients when it is moist as opposed to dry.
I know what I'm making for dinner.
All right, so Ethan is on the go for grilled chicken. I'll have sushi tonight.
Okay.
So,
Wonderful.
scrambled eggs.
9 out of 10. Again, high quality protein. It's rich in choline and other micronutrients. For our bariatric patients, actually, it's an easy early post-operative staple food. It's to-go food really very early. It has to be cooked in a soft manner, though, as opposed to be hard for them to be able to tolerate it early after surgery.
All right, salmon.
Salmon, 10 out of 10. High quality protein, again, with the addition of very good fats in the omega-3 fats that have good anti-inflammatory, and they are heart friendly and healthy. For our bariatric patients, it's definitely a good source of protein. It's a lot softer than red meat, with soft texture. Obviously, it's better tolerated, but they have to watch out for calories. It definitely does have high calories because of the fat, so portion is important.
All right, protein shakes.
I would say 9 out of 10. Again, it's protein dense, of course. It's rich in some important amino acids like leucine. It has a low glycemic index, particularly if the preparation is done appropriately. For our bariatric patients, it's actually an essential to go to nutrient early post-operatively when they can just do liquids. So it's a good source of protein for them. But they have to be careful because not all protein shakes are bariatric friendly in terms of their calorie and sugar. So they have to follow the nutritionist's recommendation.
And daily meat, like turkey or chicken.
I would say 6 out of 10. And it's good protein, but it's high in sodium, in salt, essentially.
Right, salt
And
is
it's
a good
often
one.
processed as well. And that obviously is something that we're not very fond of. For our bariatric patients, yes, it's an acceptable option for protein in moderation again, but it's often too dry for them to tolerate it well, particularly early after surgery. If they would like to have it, I would say try to choose something that has low salt and it's as little processed as possible.
And tuna, canned in water.
9 out of 10. It's lean protein, low calorie, it's very satisfying. and we have to be moderate, right? We
Yeah,
cannot go too strong on it
absolutely.
because too much mercury. Mercury is a metal that could be too
Right.
much in tuna if we overdo it. For our patients, it's an excellent choice. I would say try to find something different than mayo to mix it, maybe some Greek yogurt or something like that.
Turkish yogurt.
Turkish yogurt, yes, yeah,
so,
I take that back.
cottage cheese.
I would say 9 out of 10. It's high protein, it has calcium, it's something that is digested very slowly, so it gives more satisfaction and satiety. For our bariatric patients, it's really one of the best soft protein options, particularly early after surgery.
And steak, lean cuts.
Lean cuts, yeah, like sirloin or filet, I would say 8 out of 10. It has high protein, it has iron, it has B12, it has zinc, very important micronutrients. For our bariatric patients, it's really hard early after surgery just because it's very difficult to tolerate because it's hard, right? So if they do decide to have it, it should be really later on after surgery and then make sure that they chew it really well.
So in this case, the chicken is a
Way
better
better,
option.
yeah, much better option, yes.
And the like plant-based protein, tofu or tempeh, like this is coming up again.
8 out of 10. So complete protein, particularly for people who are vegetarian or vegan, lots of fiber, and it's heart healthy. For our bariatric patients, it's good option, definitely. I would say temp more than tofu in terms of its protein content and fiber, but for bariatric patients at the same time, tofu may be better tolerated because of its softness.
Black beans
8 out of 10. Good thing is lots of fiber in it.
and a lot
It's
of gas.
plant protein, lots of microproteins, micronutrients, and it's a type of carb that is slowly digested. So it's a good carb from that point of view. But the portions have to be moderate. As you mentioned, gas and bloating could be issues.
Yeah, don't eat in public, please.
For our bariatric patients, really, they are better off with other protein sources that will give them more protein and less issues.
So today, last week was our lowest average. This week is our highest average, so 8.7. Now, one thing, I mean, sometimes I share too much, but I'm going to share anyway. So with the grilled chicken, so sometimes it can be dry, right? So just little bit Turkish/Greek yogurt, because I love my Greek people too. So and some hot sauce if they can tolerate. Like instead of using ketchup or some other
Yeah, so that
fat
it's not
stuff,
too
so that-
bland, essentially.
so like
yeah.
this, just making it as the dipping for that would be helpful.
Yes.
And you can use the same one for like some vegetables like broccoli and others. So that's really like the yogurt, plain yogurt with some hot sauce that
Yeah.
does actually help with the smooth eating. Well, this was fun.
Yeah.
So
Always is.
We are gonna do some other alternatives to this. So in the future episodes, but today really the main issue for us is that complications of bariatric surgery. What actually is? What are the complications and how we can actually fight and prepare for those? So it's all about claiming or reclaiming your life. So that starts with it. Our goal is to help as many people as possible who are looking and already made a decision. That's one, but also who are kind of on the edge of the fence on whether or not I should do this or live with 50, 55, 60 BMI. Life is not easy, and that has its own complications. So that's kind of my main point, our main point for today. And Dr. Irgau, thank you for joining us.
You're welcome. Thank you.
Will be the next 2 weeks. We may have a Turkish edition with one of our nutritionists. That time we did the first episode, Elvan Odabaşı, and then we'll have an OBGYN. She's very famous actually, so she's going to be joining us.
Wow.
And then I wanted us to kind of focus on the morbid obesity, and then we are going to discuss the menopause and the early weight gains on especially yours and the complications of those. So she is going to be our guest. I don't know if it's going to be on Fridays, both the 2 weeks, but we'll have two Turkish
that should be
editions for
exciting.
this.
Wonderful.
Yeah. All right. Well, thank you so much, and thank you for being with us. And we'll see you soon. Until the next time, stay united. Bye-bye.